Last year, I had an ovarian cyst called an endometrioma, which was the size of a cantaloupe. It was extremely painful and caused a lot of issues. I found an endometriosis specialist. He removed the cyst and also did endometriosis excision surgery. My pelvic cavity was full of endometriosis. After surgery, the physician tells me I should go on birth control to prevent the reoccurrence of future ovarian cysts and to stop any more endometriosis from occurring. I ignored the doctor's words because I was promised the doctor got about 97% of my endometriosis. Why should I be worried about a tiny amount of endometriosis? A month after having surgery for endometriosis, I start having significant pelvic pain. The pain grows worse and worse. 4 months after having surgery, a chocolate ovarian cyst ruptures, which sends me to the hospital because the pain is very severe. 6 weeks after going to the emergency department for the ruptured ovarian cyst, I begin having pelvic pain again. Another ovarian cyst has formed. I decide I should probably follow the surgeon's instructions. I need to get oral contraception to control my endometriosis. I call my primary care doctor and schedule an appointment. Today, I visited my primary care provider. As I'm waiting for my appointment, I suddenly remember my doctor is a Christian. I begin wondering if my doctor prescribes birth control. After waiting over an hour, I'm called back to an examination room. I wait another 30 minutes for the physician. When the doctor begins my appointment, he asks the reason for my visit. I tell him I would like birth control to help reduce the progression of my endometriosis. The doctor tells me he will not prescribe birth control. If I want oral contraception, I need to go to an obstetrician, gynecologist. My physician finds a specialist and makes a referral. I am told the specialist is very busy. Since I am not pregnant and it is not a medical emergency, it will most likely be a 4 to 6 month wait before I'm able to get an appointment to see the specialist. My visit ends. As I sit in the reception area, waiting for my ride, I am heartbroken. If I have to wait 4 to 6 months to see a specialist, will my ovarian cyst continue to grow? Will my endometriosis worsen? I decide I should try to get birth control someplace else. Everyone always talks about how easy it is to get the medicine. This should be simple. I begin thinking about places which may prescribe birth control. I remember the organization Planned Parenthood. I look on the organization's website. I am in luck. They prescribe birth control, and there's an office nearby. I call the company. I ask the receptionist if the facility takes my insurance. She says they do not. I am told if I want birth control, it will cost $250. My mouth drops open. $250? I cannot afford that. I thank the woman for the information and hang up the phone. My transportation arrives and I leave my primary care doctor's office. As I ride in the car, I search the internet for other providers. I find another primary care doctor's office. I search their website. It states many services offered, but contraception is not listed. I move on. I call another primary care provider's office. I ask if they prescribe birth control. The receptionist says they do not. Finally, I discover a walk-in clinic. Yes, they prescribe birth control. I ask the driver if I can be dropped off at the walk-in clinic, but as the words are leaving my mouth, I realize I'm extremely tired. My blood sugar is rapidly dropping. I'm having a hypoglycemia episode. My head is screaming in pain. My body is about to have a major health crash. I tell the driver I need to go home as fast as possible. I am not feeling well. 45 minutes later, I arrive home, exhausted and feeling a little defeated. I was hoping to find a reprieve from my ovarian cysts and endometrioma, but I guess that is not going to happen anytime soon. Thank you so much for joining me. Please remember to like and subscribe down below. I hope you have a great day and a wonderful week. Bye-bye. As I was editing this video, I realized there may be some people who will be outraged that I said it might be a 4 to 6 month wait to see an obstetrician gynecologist. Let me explain something about having pregnant women as patients. If a pregnant woman needs medical care, she needs medical care now. She cannot wait a month or two for an appointment. Prenatal care is extremely important. There are key times during the pregnancy which need to be monitored. The sooner a woman obtains prenatal care, the less likely she will have complications. My medical challenge will only affect me. If a pregnant woman has a health challenge, it will not only affect the mother, but also the baby. I will happily wait 4 to 6 months if that means the doctor will have time in his schedule to see a pregnant woman. Moreover, as I stated in the video, there's another medical facility I can go to get medical care. Whether I go to the walk-in clinic the next time I travel 45 minutes to the city, or wait for my appointment with the obstetrician gynecologist, that is still being pondered. When God closes a door, I always remind myself to not force it open, as there may be a reason the door is shut.